Hello, I'm Kerry Straine. As I meet with dental practice owners throughout the United States, we begin in the development of their strategic plan with an understanding of what their mission is. But as we cast a vision that helps them assemble the team to carry out and deliver on their mission, we look at four components of a successful dental practice that have to come into orchestration to allow that team to not only survive but thrive in this dental economy and in better ones to come. The first one is what we call the patient base. We believe an active patient is an appointed patient, and that for every 600 patients, you're going to need a full-time hygienist. The second component is the facility. We believe that a practice owner needs to have a minimum of 4 to 5 treatment rooms per doctor and the associated hygiene team in order to be able to house the number of patients, 1,200 to 1,400 patients in continuing care, to make the practice economically viable. In the old days, back in the 90s, back in the 80s, dental practice owners could make it on 2 or 3 operatories with 1 full-time hygienist. But in today's challenging economic market, if we don't have approximately 1,200 to 1,400 patients in continuing care, there's not a pool of people available to draw from on a daily basis, in addition to the new patients, to keep the doctor busy at a level sufficient to meet the financial obligations of the practice. And if you want to recession-proof your practice, you're going to make sure you have a facility that houses enough patients so that when 10% of the economy is challenged, you certainly are protected by the recurring customer flow and the 2 hygiene chairs that you've got that are going to allow you to generate the dental production out of the 2 to 3 chairs that you have as well. The third is your staffing component. We believe in the simple 2-2-2 model for the employee team for any general dental practice. 2 hygienists, obviously, 2 assistants, and 2 administrators. Now, the 2 administrator team can be reduced if you're decentralizing a lot of transaction processing chairside. We have many clients throughout the country who have 1 administrator supporting 2 assistants, 2 hygienists, and 1 doctor, because the collection, scheduling activity is done chairside, and the confirmation activity is done electronically with tools that Henry Schein provides for you to consider. Please meet with your field sales consultant to look at those tools. The fourth component is the economic component. The economic component says, we believe there needs to be a fair economic exchange between the patient and the practice. They need to perceive value, and that requires educating the patient and putting energy and empathy into every point of contact. We believe there needs to be a fair economic exchange between the employees and the practice. Your employees need to be paid fair market value and have an associated benefit program that allows them to understand that their life goals are being met, providing no obstacles in the way of their commitment to helping you every moment of the day deliver on your mission. Fourth component, the economic component, is that the owner of the practice is paid fairly. Unfortunately, most dental practice owners are underpaid. But with a clear vision of how your business is going to work, understanding the opportunities you have every day to overcome the challenges you have, you can lead a dental team to capitalize on the golden years in dentistry, which are just ahead. I wish you the best on your journey.